I'm Dr. Medora, and today we need to have a brutal, life-saving conversation about why the human kidney is universally feared by physicians as the ultimate silent killer. You see, your kidneys are incredibly stubborn, stoic, and proud. They don't cry out when they're hurt. In fact, your kidneys can lose up to 80 to 85% of their operational capacity. They can be literally dying inside you before they ever cause a single ounce of sharp pain or give you a dramatic warning sign. They don't scream, they whisper, and in our fast-paced American lifestyle, filled with high-stress environments, heavy caffeine reliance, and an alarming rate of over-the-counter medication use, millions of people are completely deaf to those whispers until they find themselves in an emergency room staring at a dialysis machine. In my years of medical practice here in the United States, I have seen too many patients walk into my clinic completely blindsided. They look with tears in their eyes and ask, "Dr. Medora, how is this possible? I felt completely fine last month. How can my kidneys be failing today?" The truth is, they weren't fine last month. Their kidneys were desperately crying out for help, but the signals were mistaken for everyday fatigue, a poor night's sleep, or simple skin allergies. Today, I want to pull back the curtain and walk you through the 7 critical, quiet warning signs that your kidneys are struggling to survive. We will break down the exact science behind these symptoms, what they feel like in real life, and how you can spot them before irreversible damage occurs. If you or a loved one are experiencing even 2 or 3 of these signs, it is an absolute mandate to get tested. Let's look at these 7 silent warnings with absolute clarity. Let's begin with sign number 1, chronic, overwhelming fatigue and brain fog. Now, I know what you might be thinking. Dr. Medora, every single adult in America is tired. We work long hours, we juggle family responsibilities, we rely heavily on caffeine, and we rarely get a perfect 8 hours of sleep. It is incredibly easy to brush off feeling tired as just a byproduct of a busy modern life. But kidney-related fatigue is fundamentally different from normal everyday tiredness. Normal exhaustion can be fixed. If you have a demanding week, you sleep in on Saturday, you rest, and your energy levels bounce back. Kidney fatigue, however, is an absolute bone-deep exhaustion that no amount of sleep, rest, or espresso can fix. You wake up after a full 9 hours of sleep, feeling just as drained, heavy, and empty as you did when your head hit the pillow the night before. Alongside this physical drag comes a distressing cognitive symptom known as brain fog. You find it difficult to concentrate on simple tasks at work, you lose your train of thought mid-sentence, your memory feels hazy, and you experience a general sense of mental cloudiness. Why does this happen from a medical standpoint? Your kidneys are not just passive filters, they are highly sophisticated endocrine organs. One of their primary, lesser-known responsibilities is the production of a crucial hormone called erythropoietin, which we in the medical field refer to as EPO. This vital hormone travels through your bloodstream directly to your bone marrow, acting as a chemical master switch that commands your body to produce fresh, healthy red blood cells. As you may know, red blood cells are the biological delivery trucks responsible for carrying oxygen from your lungs to every single tissue, muscle, and organ in your entire body, including your brain. When your kidneys become diseased, damaged, or overworked, their ability to produce EPO plummets. Without enough EPO, your bone marrow stops manufacturing an adequate supply of red blood cells. This triggers a progressive, severe internal condition known as anemia. Think about it logically. If your body is running low on red blood cells, your muscles, your heart, and your brain are being starved of the vital oxygen they need to function optimally. Your body essentially goes into a low-power, energy-saving mode. You feel weak, your limbs feel heavy like lead, and your brain struggles to process information. If you are experiencing a persistent, unexplainable drop in your daily energy that sleep cannot cure, your kidneys might be struggling to produce the fuel your body needs. Moving on to sign number 2, dramatic and subtle changes in urination. Since the primary, most visible function of the renal system is the production and excretion of urine, it stands to reason that any internal structural damage to your kidneys will manifest directly in your bathroom habits. However, because we don't exactly spend time analyzing our urine, these signs are frequently ignored until they become impossible to miss. There are 3 specific changes in urination that you must watch for with absolute vigilance. The first is an increase in nighttime urination, a clinical condition we call nocturia. If you used to sleep peacefully through the night without ever needing to use the restroom, but now find yourself waking up 2, 3, or 4 times every single night to urinate, this is a major red flag. When kidney filters, known as nephrons, begin to fail, they lose their ability to properly concentrate urine. Consequently, the kidneys produce a larger volume of diluted urine, forcing your bladder to fill up repeatedly throughout the night, disrupting your sleep cycle and leaving you exhausted the next day. The second critical urinary change is the appearance of highly foamy or bubbly urine. I am not talking about a few bubbles that pop and disappear within a second or two after urinating. I am talking about a thick, persistent, frothy foam that looks exactly like whipped egg whites or the head on a glass of beer. This foam refuses to dissipate, and even after you flush the toilet, remnants of it often remain behind. In the medical world, this is a classic indicator of proteinuria, which means valuable proteins, specifically one called albumin, are actively leaking out of your blood and into your waste. In a healthy body, the microscopic filters in your kidneys are tightly knit, allowing small waste products to pass through while keeping large, essential molecules like proteins safely inside your bloodstream. When those filters become frayed, torn, or inflamed, they develop microscopic holes, allowing your body's vital proteins to escape. This is a severe warning sign that your filtration system is structurally compromised. The third urinary change is the presence of blood in the urine, medically termed hematuria. If your urine takes on a pink, reddish, or dark, smoky brown tint resembling tea or cola, you need to seek immediate medical evaluation. When the delicate filters of the kidney are damaged, blood cells begin to slip through into the urine. Sometimes this blood is visible to the naked eye. Other times it can only be detected under a microscope during a routine lab check. No matter how small the amount, seeing blood in your urine is never normal and should never be dismissed. Let us discuss sign number 3, swelling in your ankles, feet, hands, or puffiness around your eyes. Have you noticed lately that your favorite pair of shoes feels unusually tight by the end of the day? Do your socks leave deep, painful, indented rings around your ankles when you take them off in the evening? Or perhaps when you wake up in the morning and look in the mirror, you notice an unusual, heavy puffiness directly underneath and around your eyes. This swelling is known clinically as edema, and it is a classic hallmark of declining kidney function. Your kidneys are solely responsible for regulating the delicate balance of fluid and sodium within your body. They act as a high-tech drainage system, ensuring that any excess water and salt you consume is efficiently extracted and flushed away. When your kidneys begin to lag in their performance, they lose the ability to excrete this excess fluid. As a result, water and sodium start to back up in your circulatory system and leak into the surrounding tissues of your body. Because of the natural laws of gravity, this fluid shift moves downward, settling heavily in your lower extremities, your feet, your ankles, and your calves. To test this at home, you can perform what we call a pitting edema test. Press your thumb firmly into the swollen area over your ankle bone for about 5 seconds. When you remove your thumb, if a deep, visible crater or indentation remains in your skin and takes several seconds or minutes to slowly fill back up, you are dealing with fluid retention, not weight gain. Furthermore, the loss of protein in your urine, which we discussed earlier, worsens this swelling. Protein in your blood acts like a biological sponge, holding water inside your blood vessels. When you lose that protein, water leaks out of the vessels and into the tissues, causing that characteristic morning puffiness around the eyes where the skin is thinnest and most delicate. Sign number 4 is one that confuses many patients because it seems entirely unrelated to your internal organs: severe dry, cracking, and intensely itchy skin. Patients often come to me after spending hundreds of dollars on luxury moisturizers, specialized dermatological creams, and over-the-counter allergy medications, complaining that nothing is working. They describe a unique, maddening itch that doesn't feel like it's on the surface of their skin. Rather, they describe it as a deep, internal itch that feels like it is originating directly from inside their muscles or bones. They scratch until their skin is raw, bleeding, and bruised, yet they find absolutely no relief. The pathophysiology behind this is deeply tied to renal health. Your kidneys are tasked with maintaining a flawless equilibrium of essential minerals and nutrients in your blood, specifically calcium and phosphorus. When your kidneys fail to filter effectively, they are unable to clear excess phosphorus from your bloodstream. Consequently, your blood phosphorus levels skyrocket, while your calcium levels dramatically drop. This severe mineral and bone disorder causes microscopic crystals of calcium phosphate to deposit directly into your skin tissues and nerve endings. At the same time, the buildup of uremic toxins, the waste products that your kidneys should have filtered out, wreaks havoc on your sweat and oil glands, causing your skin to become incredibly dry, dehydrated, brittle, and inflamed. This combination of dry skin and toxic mineral deposits creates a relentless, systemic itch. If you are suffering from severe, unexplained, body-wide itching that doesn't respond to typical skincare treatments, it is vital to look beyond the surface of your skin and check your kidney function. Now let's move to sign number 5. A distinct metallic taste in your mouth and ammonia-scented breath. This is an incredibly common yet subtle symptom that fundamentally alters a person's quality of life. Patients will often notice that their favorite meals suddenly taste completely unappealing, bland, or downright disgusting. They frequently describe a persistent, unpleasant taste in their mouth that mimics the sensation of chewing on a piece of metal, aluminum foil, or a rusty nail. This condition is known in medicine as dysgeusia. Along with this metallic taste, a person's breath may take on a distinct, sharp, pungent odor that smells strikingly like ammonia, stale urine, or commercial glass cleaner. The science behind this symptom is both fascinating and alarming. When your kidneys are compromised, they fail to clear a major metabolic waste product called urea. As urea builds up to dangerously high levels in your blood, a toxic state known as uremia, it begins to diffuse into all body fluids, including your saliva. Inside your mouth, naturally occurring oral bacteria contain an enzyme that immediately breaks down this excess urea into ammonia gas. It is this chemical reaction happening right inside your mouth that creates that terrible metallic taste and gives your breath a distinct ammonia scent. Because your taste buds are constantly bathed in this toxic environment, your appetite completely vanishes. The thought of eating, especially protein-rich foods like meat or chicken, can cause intense aversion, leading to sudden, unintended, and dangerous weight loss. Sign number 6 is one of the most frightening symptoms a person can experience: shortness of breath, even with minimal exertion. Imagine walking from your living room to your kitchen, a distance you've covered thousands of times without a second thought, and suddenly finding yourself gasping for air, clutching your chest, and feeling as though you've just sprinted up a steep hill. You try to take a deep, satisfying breath, but your lungs feel restricted, heavy, and completely full. This terrifying symptom occurs due to 2 distinct, devastating mechanisms caused by kidney failure. First, as we established earlier, failing kidneys cause massive fluid retention throughout the body. When this fluid backup becomes severe, the excess water doesn't just stay in your legs. It begins to migrate upward into your chest cavity, leaking directly into the air sacs of your lungs. This medical emergency is known as pulmonary edema. When your lungs are partially filled with fluid, there is physically less room for oxygen to enter your bloodstream, leaving you with a constant, panicky sensation of suffocation, which often worsens dramatically when you try to lie flat in bed. The second contributing factor is severe anemia. Because your failing kidneys have caused your red blood cell count to drop significantly, the blood that is flowing through your lungs simply doesn't have enough vehicles to carry oxygen to the rest of your body. Your lungs are forced to work twice as hard, pumping rapidly to compensate for the severe lack of oxygen transport. If you find yourself unusually short of breath during simple, everyday activities, it is an urgent sign that your internal filtration and fluid balance are in jeopardy. Finally, we arrive at sign number 7, persistent, unexplained nausea, qualms, and vomiting. In the earlier stages of kidney issues, A person might experience a mild passing wave of queasiness in the morning that they easily mistake for indigestion, a mild stomach bug, or dietary indiscretion. However, as the months go on, this nausea becomes a constant, debilitating shadow that hovers over every single day. You wake up feeling sick to your stomach, the smell of cooking food makes you intensely nauseous, and even sipping plain water can trigger sudden, violent episodes of vomiting. This happens because your body is quite literally poisoning itself from the inside out. When your kidneys are no longer operating as the body's primary filtration system, metabolic wastes, acids, and uremic toxins accumulate to toxic, unprecedented levels within your bloodstream. Your brain possesses a highly sensitive, specialized chemical sensing zone designed to protect you from harm. When this zone detects that your bloodstream is saturated with these toxic waste products, it assumes you have ingested a deadly poison. In a desperate, protective effort to purge this perceived poison from your system, your brain repeatedly triggers the vomiting reflex. This chronic state of uremia irritates the entire lining of your stomach and gastrointestinal tract, causing inflammation and making it impossible to keep food or fluids down. This creates a dangerous downward spiral of dehydration, malnutrition, and rapid physical decline. If you are listening to these 7 signs and realizing that some of them align perfectly with what you have been experiencing lately, please do not panic. My goal today is not to frighten you, but to empower you with the knowledge to take immediate, decisive action. Discovering a kidney problem is not difficult, nor is it incredibly expensive. You do not need to undergo complex, painful procedures to find out exactly where your health stands. All it takes is a simple visit to your doctor's office or a local laboratory for 2 incredibly basic, affordable screening tests that can give you a crystal clear picture of your renal health. The first essential test is a standard blood test called a kidney function test, which measures your serum creatinine levels. Creatinine is a natural waste product generated by normal muscle breakdown that healthy kidneys filter out of the blood and excrete seamlessly through urine. If your blood work reveals that your creatinine levels are elevated above the normal baseline, it serves as a highly accurate, immediate warning that your kidney's filtration rate is slowing down. From this number, doctors calculate your eGFR, or estimated glomerular filtration rate, which tells us exactly what percentage of your kidney function is currently active. The second test is a simple, routine urinalysis. This straightforward test checks your urine sample under a microscope to look for things that should never be there, specifically protein and red blood cells. If protein or blood is detected in your urine, it provides definitive proof that the delicate physical filters of your kidneys are experiencing structural damage or leakage. If both your creatinine levels and your urinalysis come back completely within the normal range, you can breathe a massive sigh of relief, knowing that your kidneys are healthy, stable, and functioning beautifully. Now, as a physician, I want to leave you with the 3 golden rules of kidney protection. These are simple, actionable lifestyle adjustments that you can start implementing today to ensure your kidneys remain as strong as iron, protecting you from ever needing to face dialysis or a kidney transplant. Rule number 1 is to practice smart, balanced hydration. There is a very common, highly dangerous myth circulating on social media that says the more water you drink, the healthier your kidneys will be. People are forcing themselves to chug massive, unnatural quantities of water every single day. This is a medical misconception. Drinking excessive amounts of water forces your kidneys to work overtime to filter out the unnecessary fluid volume, putting undue stress on the system. For the average, healthy adult living in a moderate climate, consuming roughly 2 to 3 liters of total fluid per day is perfectly adequate. Listen to your body, look at the color of your urine. It should be a pale, straw-like yellow, not crystal clear like water, and not dark like apple juice. Always drink your water mindfully, taking slow sips while sitting down rather than chugging it rapidly. Rule number 2 is an absolute necessity in American culture. Stop the indiscriminate use of over-the-counter painkillers. We live in a society where it is incredibly common to pop an ibuprofen, naproxen, or diclofenac for every minor ache, headache, or muscle soreness. These common medications belong to a class of drugs known as NSAIDs, or non-steroidal anti-inflammatory drugs. What most people do not realize is that NSAIDs are heavily toxic to the kidneys when taken frequently or in high doses. They work by blocking certain chemical pathways, which unfortunately causes an immediate, sharp constriction of the blood vessels supplying your kidneys. This starves your kidneys of oxygen-rich blood, leading to a condition known as acute kidney injury. If you have chronic pain, speak to your doctor about safer alternatives, and never treat over-the-counter painkillers as harmless candies. Rule number 3 is to aggressively manage and control your blood pressure and blood sugar levels. Globally, diabetes and hypertension are the twin monsters responsible for over 80% of all cases of total kidney failure. When you have chronically high blood sugar from unmanaged diabetes, the excess glucose acts like microscopic shards of glass, physically scarring and destroying the delicate microscopic blood vessels inside your kidneys over time. Similarly, when your blood pressure is high, the force of the blood crashing against the delicate filters of the kidney is so intense that it blows out the filtration system, causing permanent tissue scarring. If you have been diagnosed with high blood pressure or diabetes, taking your prescribed medications consistently, eating a low-sodium, low-sugar diet, and maintaining an active lifestyle isn't just about managing those numbers, it is the ultimate shield protecting your kidneys from destruction. Your body is a magnificent, highly interconnected system, and your kidneys are working silently every single second to keep you alive, balanced, and free from toxins. Please, pay attention to the subtle signals they send you. Don't repeat the mistakes of so many who waited until it was too late. Thank you so much for listening to me today. If you found this information valuable, please share this audio with your friends, your family, and your loved ones. You never know whose life you might save simply by sharing the gift of medical knowledge. Stay healthy, stay vigilant, and take care of your beautiful body. I'm Dr. Medora, and I will see you next time.